Labor is divided into 3 stages. Stage 1 is preparation phase. During this stage, the fetus is positioned for birth. It generally lasts a number of hours in the naturally foaling mare. During stage 1, the mare is restless. She paces, lies down and gets up, and urinates and defecates frequently. She may appear anxious and look at her flanks. Mares apparently have some control over the foaling process during the first stage of labor. A disturbance may cause her to postpone delivery for some time, even days. The second stage of labor begins with a rupture of the chorioallantoic membrane and ends with the delivery of the foal. This phase lasts between 15 and 30 minutes. As the water breaks, the forelimbs are presented at the vulva, one slightly ahead of the other. The head will follow soon after, resting on the forelimbs. Most mares are in lateral recumbency during delivery of the foal. Groups of 3 or 4 forceful contractions are followed by rest periods lasting 2 to 3 minutes. Mares will generally get up and reposition themselves during second stage labor. If the red velvety chorioallantois does not rupture, it will be presented at the vulva covering the foal. In most cases, the avascular region of the chorioallantois, called the cervical star, will emerge first, and this should be ruptured immediately. It indicates premature placental separation. The mare strains during delivery. Maximum straining occurs with the passage of the shoulders through the pelvis. She will stop straining after the foal's hips have passed through the pelvic canal. The foal is often delivered in the thin, white, slightly opaque amniotic membrane. Occasionally, the foal is delivered with the amniotic membrane covering its head. If this happens, remove the membrane from the foal's head to avoid suffocation. Allow the mare and the foal to rest undisturbed after delivery. The mare will roll onto her sternum after the fetus is delivered. She may rest for 10 to 20 minutes in this position. Once the foal becomes active, she will rise and go to the foal. Movement by the mare or the foal will cause the umbilical cord to rupture a few inches from the foal's body. The third stage of labor involves passage of the fetal membranes and involution of the uterus. Most mares will pass the membranes within an hour or two after the foal is delivered. Signs of mild colic are common during placental passage. The placental membranes are usually inverted as they are expelled, and the smooth allantoic surface is outermost. However, in this delivery, the red chorionic surface is outermost.